request.
Thank you, Mr. Speaker. The Crowfoot Village Family Practice is one of the great innovators of healthcare delivery in Alberta. They have developed a unique model to provide a high quality of care to Albertans. This PCN provides service to 2% of all Calgarians, including myself and my entire family and 25,000 other people. It saves the government up to $17 million a year in hospital costs. So I was surprised to hear that Crowfoot might be facing a sizable reduction in their funding for the coming year. To the Minister of Health, is it true that CVFP is facing a 20% cut?
Minister of Health.
Thank you very much, Mr. Speaker, and to the member for the question. When I moved into this portfolio back in May, I learned about the cuts that were being proposed by that very same government that had been in previously, that were far greater than the conversation we've had with PCNs to ensure that we have stability of frontline services. There are a number of PCNs that have millions of dollars in surplus. We've said having money sitting in the bank when you have patients who need to be cared for is not the right way to spend taxpayer money. So what we've done is work in collaboration to work with PCNs and discuss ways that they can use their reserves to offset this year's current operations so that money isn't sitting in the bank, Mr. Speaker.
First supplemental.
Thank you, Mr. Speaker. Again, to the same minister, we can appreciate the issues around cash reserves. However, given that the work done by Crowfoot has resulted in significant reductions in ER visits and hospital admissions, and given that we have heard from constituents that Crowfoot was already denied the 2.5% increase in physician funding that was approved in 2015, and given the government's stated goal to ensure stability in the healthcare field, can the minister explain the rationale as to why Crowfoot might be penalized?
Good question.
Honourable Minister of Health.
Thank you, Mr. Speaker, for the question. As the House is well aware, I launched a financial review of PCNs because I wanted to make sure a number of them are being very responsible with their allocations, spending them on primary care within a reasonable time frame, a year or 2 years of when they've received those allocations. Others have been sitting on millions of dollars of reserves, Mr. Speaker, and that certainly isn't in the best interests of Albertans. The financial review is in the processes of wrapping up. I've been working in collaboration with the PCN leads to make sure that they have an opportunity to give their feedback on the report, and I'll be happy to share an update with this House likely in the early months of the new year around specifics of how we're going to be moving forward in partnership with PCNs, Mr. Speaker.
Second supplemental.
Thank you, Mr. Speaker. So I'm assuming you're insinuating that Crowfoot's not being responsible. I just want to be clear on that. And it's worrisome that primary care networks like Crowfoot, who are showing such great results, would face these kind of cuts. Given that the government has prided itself on standing up for frontline services, and with Crowfoot providing world-class service to the community, can the minister tell us whether she supports the work of PCNs like Crowfoot, and if so, will she reverse these cuts?
Thank you, Mr. Speaker. The budget that was proposed by the party that the member opposite is a part of would have had all of the reserves taken back, and that was rejected. That was seen as being rash and short-sighted. So what we've done is work in partnership with the PCNs to find ways that we can be responsible with the money that's sitting in the bank and working in collaboration. So every PCN receives $62 per patient per year towards operating the PCN. What we've done is we've said if you have significant reserves, we want you to help offset that allocation this year, because of course everyone knows what a difficult financial year this is for Albertans and for Alberta families.